Okay, I think we are at 5:33. So let's get started. Hi everyone, very warm welcome to BBMP Mahadevapura Zone RWA Connect, 30th December 2021. Special thanks to Dr. K.V. Chandra, IAS Special Commissioner for Health, BBMP, for taking his time and joining to address our zone. And also thanks to Mr. R. Venkatachalapati, KS, for Joint Commissioner for BBMP Mahadevapura. Warm welcome to you both, sir. Special thanks, and over to you, Venkatachalapati, sir, for initial address and to introduce Chandra, sir. So, yeah, you can take over from here.
Good evening to everyone. So I heartily welcome our Zonal Commissioner, sir, Sri Chandra, sir, for this meeting. And also I heartily welcome Bangalore Apartments Federation General Secretary, Mr. Vikram Rai, and BF Zonal Leaders and Governing Council members, Mr. Vishnu Gatpalli, Mr. Dheeraj Gupta, and Mr. Pradeep Rai, and BF Whitefield 1, Mr. Lakshman, Mr. Upendra Singh, Secretary, BF Whitefield 2, Mrs. KG Indra, President, Mr. Sabyasachi, Secretary, BF Bellandur, Mr. Luke, President, and Mr. Vinod, Secretary, BF Bellandur Gate, Mr. Sridhar, President, Mr. Manto, Secretary, BAF Kerpuram, Mr. Sunil Thomas, President, Mr. Nakesh, Secretary, BAF Basanagra, Mr. Jaishankar, President, Mr. Kuntal, Secretary. And I also welcome Mr. Surendra, Health Officer of Mahadevapura Zone, and our MOH, Srimati Sunita. I welcome everyone for this meeting. And it is over to our Chandra sir to speak few words.
Thank you, JC sir. Sir Chandra sir, over to you.
Yeah. Good evening, everybody. Thank you, Vishnu, Venkatachalapati. Thank you, all of you, for joining at this very short notice. All of you are aware New Year is around the corner, and also the cases are also on the upswing, and there's potential for a major upswing is on the anvil. So in that backdrop, we wanted to connect with you to understand your concerns. Mahadevapura is reporting the highest number of cases in BBMP limits. It has been consistently reporting the highest number of cases over the last 2 months, and last 2 days when we are having this concerning upswing. Again, Mahadevapura is leading the pack. So it's not a very great place to be. So that is the concern we have, and we wanted to connect with all of you to ensure that Mahadevapura remains safe, and we need to protect all the citizens of Mahadevapura. And in that backdrop, there were some concerns about what are the precautions to be taken during the New Year celebrations, and what are the do's and don'ts. In that backdrop, we wanted to interact with you, ensure that there are no super spreader events happening. All of us should be safe. Already the government guidelines are out with respect to the Christmas and New Year celebrations. And we wanted to, and there are almost 20 odd clusters already in Mahadevapura. So apartments continue to be the hotspots. So we should ensure that all the RWAs, all the like-minded citizens like you should ensure that nobody indulges in reckless behavior. There are no COVID inappropriate behavior happening among any apartments, individual units, any of your friends and family, so that, as I already said, everybody should be safe. Those who are not vaccinated, partially vaccinated, persons should be immediately tested and isolated. All of you are aware, Omicron case, many foreign returnees are there amongst the apartments in Mahadevapura. So any such undetected case or any such person who does not contain himself or not in isolation can lead to a large scale outbreak. So we don't want to be in a situation where we need to enlarge the containment zone or place a larger apartment block under as a declare it as a major containment zone, which will lead to obvious inconvenience to many people. But if it comes to that, we will have to do it because it's in the larger interest. So the best way is prevention. We need all your cooperation. Ensure that there are no such um, congregations and celebrations which can lead to such kind of localized outbreaks. So that is the backdrop with which we wanted to interact with all of you. So Vishnu, you can moderate a few of the people, a few members who want to talk, and then we can take it further. Thank you.
Sure, sir. Absolutely. Yeah. So should we start with few questions then? Do we go in that mode, sir?
Yeah, we can do that. Yeah.
Okay, sir. So I have, I think, first 2-3 questions I will ask based on what people have been asking me, and then based on it, we'll take a few questions from the audience as well. So one of the first question that people ask is, since the outside celebrations are limited, that 10 p.m. is the night curfew, and people tend to celebrate within the apartments, or some apartments tend to conduct some sort of a parties within the clubhouses. So the question is, I believe the 10 p.m. limit is still applicable for those celebrations with COVID appropriate behavior. Is that true?
No, with respect to bars, pubs, that applies to your whatever party areas which apartments have also.
Yeah.
So it comes under the same category if you go definition wise. So those restrictions would apply to such places as well.
Yeah, sure. Yeah, got it, sir. So in short, even if someone is doing some sort of a celebration, that should end at 10 p.m. Thanks for that. So also there is one more a bit of it's not ambiguous, but I would say it gives quite a bit of leeway. So within the notification, it states that there is a limit of 300 people in terms of gatherings, right? So that is meant for larger functions like weddings or political rallies or things like that. But in general, if the same applicability is done for, let's say, small apartment of 100, 200 flats, right? So then 300 limit is as good as people are doing in a full strength mode celebrations. So any advice for from your side for such scenarios?
See, the 300 limit is also there, subject to the condition that per person 3.25 square meter space is available and it's well ventilated. It's not a conditioned air kind of a situation. See, all those semantics we can get into.
Yeah.
But if we are talking about public health kind of a scene here, and we are in the verge of a major upswing. So we cannot take it very lightly, and it's not doesn't give anybody pleasure to clamp down or impose restrictions on any celebrations. Let us be very clear on that. It's not anybody's intention. It is in the larger public interest. It's being done. We know what happened during the second wave. The same kind of talk was there. Same kind of mentality was there.
Yes.
So and you know what happened after that.
Absolutely.
So again, Mahadevapura was one of the worst hit. You know how many cases were getting reported every day. You also know how many cases are getting reported in places like UK, US, France, Denmark. So they are not very pleasant numbers to even to quote. So I don't think any sensible person would be even contemplating encountering such situations.
Absolutely, sir. Absolutely. But like you rightly said, right? So generally people tend to sometimes have shorter memories, like, whatever the nightmare situation that you've gone through wave 2, like, people tend to forget. Yeah. Thanks for that. So now the, final question that I think last time also in one of the meetings, we requested that can the, marshal team contacts be provided or for each ward or for each SPOC, for instance, especially considering there could be violations on the New Year's Eve or something like that. So is there any plans from BBMP side to ramp up, the marshal teams and provide any contacts to apartments so that they can dial for unruly behavior to ensure that COVID appropriate behavior is followed?
Yeah, sure. Mr. Venkatachapati would circulate the numbers among your group.
Yeah.
Chalpati, you can please do that. so that people can contact your
Yes,
health
sir.
staff as well as the marshals and your control room. So in case they can report such instances, and the police also can be looped in so that any such violations can be addressed appropriately.
So I will circulate in the group, sir.
Sure.
Yeah, sure.
Thank you. Then there is one question that is posted in the chat, one-on-one to me. Rand Kondal says, residents have postponed the New Year event to January 8th. We need guidance from BBMP whether such social events should be allowed. So I think the guidance stays still the same, be it for New Year or even till Sankranti, right? So the intent is to keep, the same rules are applicable, and it should stay the same way, right? Be it January 8th or for Sankranti. Yeah. So those are the initial questions. Anyone from the audience, if you would like to ask questions, please raise your hand or post it in the chat. I see a hand raised from Anu Maheshwari. You can go ahead and ask your question, Anu.
Yeah, I just want to know, like, we have received that BBMP new guideline. It says all guidelines is applicable till 7th of January only. In my society, nobody is planning, like, yet to get if anyone is planning or not. For New Year, no plan is there. For 13th January, Lohri is there. It's Lohri word is not mentioned, so we are getting that request that they want to plan is DJ and all that. How to stop that actually? We don't have any guideline for that. Can we get any guideline from BBMP for Lohri function also?
Yeah, as of now, it is still 7th of Jan. I'm sure subsequent guidelines will be communicated to you. So now let us keep that date in mind and discuss on that. Subsequent guidelines will be issued in the coming days.
Okay, thank you, sir. Thank you.
Thank you, Anu, for pointing that out. Yeah, so like Sir said, so I think we have to understand the spirit and intent with which BBMP has this meeting also is that, let's enjoy responsibly at the same time, make sure that the cases do not increase, right? So that's a balance that we need to strike. Yeah, of course, people will try to find some loopholes. Yes, that is something that we need to find. So the next question is from Pawan Bharadwaj. Can private parties in individual homes be allowed, and do they end by 10 p.m.?
Just for your information, all the clusters have been reported from the private parties. Yeah. So you are putting yourself and also all your invitees at very great risk. So please keep that in mind.
Yeah. Yeah, nonetheless, right. So even if you go by the rules, you cannot have loud music or DJ or any nuisance for anybody for 10 p.m. And also you should have the COVID appropriate behavior. Yeah, got it, sir. Thank you. Then there is another question. Ravindan says, are there restrictions for celebrations inside flats, and is there a number restriction celebration inside flats or within the apartment complex? I think it's more or less the same. We cannot stop. I mean, if somebody calls some 10 people, but associations need to be vigilant. If there is quite a bit of noise and nuisance, then probably security needs to intervene and stop that, right? So, and at least we should give a warning that, you cannot have such a huge gathering without COVID appropriate behavior. Yeah, that's one thing that we could do. So then there's one more question from Shalab from ARKCC. How are we ensuring that rules are implemented at the ground level? I have not seen any marshal, especially in Channasandra area, where I feel many violations happen. Yeah, you can share offline those details. In fact, yesterday I had a detailed meeting with the marshal chiefs also. They have been clearly instructed to be more proactive in enforcing these CAB rules. You can, Chalpati, you can take note of that and instruct your local marshal team to visit there more often so that whatever is being pointed out can be addressed appropriately.
Well, we have already formed teams, sir, marshal and our health inspectors, along with the coordination of police. There will be on road, sir. We will more concentrate on Channasandra area, sir.
Yeah, so I'm sure all the wards have been, the teams have been made. So let them patrol more visibly, interact with the RWAs, so that they also get confidence that people are there on the field to enforce it. I'll
intimate the health inspector, sir. The same thing.
Yeah, sure, sir. Thank you very much. Also, on a similar line, there is also Sanjay Ulal, who also, who reported that Hoodie Market also nobody wears masks. So yeah, maybe marshals probably should ramp up and do that. Next question from Rohan Shankar says that, sir, is it advised by the BBMPs for RWAs to check the second dose or 2-dose vaccination certificate when people enter the apartment complexes? Can this be published, empowering the RWAs? So in general, what happens is there was one notification which stated something like this, but it becomes very difficult to check. So what is the status or approach from BBMP, to tackle this, especially in malls and all, some places it's happening. And even I've noticed, let's say in some malls, they just check the vaccination certificate. They don't see cross-verify with your Aadhaar card or something like that. I think situation is slightly changing, but yeah. So what can RWS do? Will it be an overkill, or how can we go about it?
I think we had this interaction of a couple of weeks back. In fact, I had advised the RWAs, please go ahead and do check for all entrants coming into your premises, including your delivery boys. It could be your house helps who actually come into the place. So I think RWAs can do that. And it is in the larger interest. I don't think any person would mind that kind of a scene.
So, which is true, sir. I think most people are cooperative. What we are also seeing is there are some apps like what we use for apartment at MyGate, or some other apps where there is an option where people can declare themselves whether they're vaccinated or not. But still, some people refuse to give the details, or some people lie. But yeah, there are some anomalies that are there that needs to be taken care. Then there is next comment from Karthikeyan Mani. Since most of the residents are out of state for New Year celebrations, will there be any restrictions or guidelines when they return back to Bangalore? Currently, we have self-quarantine only for Kerala and Maharashtra and international travelers only. So will there be any special checks for people traveling after the New Year celebrations?
No, as you pointed out, it is for these categories only, which is there right now. But it would be advisable that you can watch out for any symptomatic persons and report. They should definitely get checked, so that we can prevent any further spread.
Okay, thanks, sir. Then again, comments from Rand Kondal and Pawan Bharadwaj says that instead of RWS requesting for marshals, which is also good, like if you share the contacts, I will circulate. Then also surprise visits by marshals will also help, like random checks, especially on the New Year Eve, today, tomorrow, day after. Like if people can, marshal teams can do random drop-ins for apartments, that would keep people on their toes. So that will be good, is what the request of people is. Then any restrictions on movement of vendors? Surya, I think your question is not clear. So what do you mean by movement of vendors?
Hi Vishnu. What I mean is, do we restrict the vendors to the main door, or do we allow them as we are allowing them now to the doorstep? So I was just wanting to get that clarification, because we are not sure if all the vendor people are vaccinated. So from that perspective, I was asking this question, Vishnu. Thank you.
Yeah, thanks. Sir, look, sir, you want to take?
Yeah, sure. See, most of these vendors declare that their staff are fully vaccinated. In fact, they put on the badges, and I'm not very sure the authenticity of that. That's why for the earlier question, I was saying you can definitely check for their vaccination status. And based on your apartment policy, many apartments say they allow their delivery boys only till the gate, or some of them do allow till the last mile. So whatever the status is, that you can definitely check for their vaccination status. They wear the mask and other due as per your security policy. You can do that. There is no issue on that.
Thank you, sir. Then the next question is, sir, we need a circular empowering RWS to quarantine international and domestic travelers. So I think it's most asked FAQ. Like sometimes the international travelers list, is only known to the BBMP people, and sometimes the people do not report to the RWS that whether they're coming back or something. Is there any plan to enforce that, or is it under control, taken care from the monitoring teams?
No, right now the circular is already there. The instructions are very clear with respect to the high-risk countries and also the non-high-risk countries, foreign returnees. So and that is being monitored by our teams and is being enforced also. So if you want, we can share that list with you. We can ask the local health teams to share it, so that you can also keep a watch on that. Chalpati, you can share it. That's not a problem.
Yeah. Sure.
Yes, sir. Circular, I'll share in the group, sir. I'll share it to Vishnu, sir.
Yeah, sure.
Sure. Then we need Maheshwari, we need BBMP guidelines for checking the vaccination status of vendors because some vendors may refuse to show it. I think that point Trilok sir has touched upon. So we can always refuse to provide them an entry if they don't show their vaccination certificate, right? So that is something that we can always take a stand. I think the vendors would always oblige that. Yeah, I think those were the questions. There are no further questions. I would like to hand over to Vikram Rai for any quick comments from his side. Vikram, any general comments from BF perspective?
No, thanks. I think Dr. Trilok, thank you so much for the constant oversight and support and obviously time to time information and guidelines. And obviously it helps to, interact with residents and give them direct confidence as well. So I would like to thank you and thanks to Venkatachalapati and team as well, sir as well. Always accessible, always helpful. So I think from our point of view, I think the general mood and the input that we have also shared to members is that the peak is always 3-4 weeks from now. So now is the time to be very cautious. Like you rightly said, the numbers which are being reported in European countries, etc., are an indication. So what we do now probably will decide how our January and February will be. So in that sense, I think a general note of advice to everybody is that yes, it's a new year. Yes, 2 years we have, muted our celebrations, etc. But I think nothing is more than precious life. So keep the celebrations responsible, keep the celebrations muted. Let us restrict as much as possible. Let us be responsible for ourselves and make sure that I think the January, February, March timeframe is not as bad as how it was in April, May, and June. I think that's in our hands only. So we are, from our point of view, as much as possible, I think we'll continue to support your efforts, sir, from the BBMP. Please feel free to reach out to us for any kind of any other issues or support that you might need. We'll wish everybody a good 2022. Let's start it positively and confidently.
2 minutes time I'll take, sir.
Yeah,
Go ahead.
Sir, total in our zone 19 apartments have been contained, sir. Just for information, I'll read the names, sir.
sure.
Rohan Vasant apartment, they're having 3 cases, sir. Gopalan Millennium Habitat having 4 cases. Gopalan Grandeur apartment having 3 cases. Tower 1 Prestige Shantiniketan having 4 cases. Alps Estate having 4 cases. DS Max Sparkle Nest having 3 cases. Prestige Shantiniketan apartments again 4 cases. Adarsha Palm Retreat Towers 3 cases. Rohan Jarko apartment 4 cases. SJR Verity apartment having 4 cases. Srinivasa Classic 3. Arunodaya Nest apartment 3. SJR Verity apartment 4. Sumudra Silver Ripples 5. Purva Palm Beach apartment 3. Godrej Air apartment 3. Richara Liam apartment 3. Sonasta Woods apartment 3. VRR Fortuna Marthalli 3 cases are there, sir. So I appeal that everyone should cooperate to the containment measures, sir. So, yes. So these are the apartments which have been from 3 days it has been raised, sir, cases from 2 to 3, 1 to 3 automatically it has been raised, sir. So they should be a little careful, sir. Out of 24 clusters, 19 are apartments in my case, sir. So more apartments I am getting cases, sir. So all the association, federation, they should cooperate us, sir, please.
Sure, sir. Absolutely. We will extend our support. Venkatachalapati, sir, for any issues, maybe you could reach out to me, Dheeraj, or anyone else. We would ensure that, appropriate measures are taken. And thanks a lot for, during wave 2, the kind of support that you and Randeep sir extended in terms of resolving some of the issues with respect to containment zone and micro containment zones. And you're always available, be it at 11 o'clock, 12 o'clock, or any time, right? So thanks a lot for that. Yeah, we would extend our cooperation for that. I think Sada has raised his hand. Maybe for final question, Sada, your question is on any plan for vaccination between 15 to 18 years. Is that your question?
That's right. Sorry, I joined little late. Probably if the update has been given, excuse me for that.
No problem. So just a quick update from BAF side. We are reviving that program of Vax for All in partnership with all other hospitals, and we are going to send a message most likely by tonight or tomorrow. Initial launch of Manipal hospitals. We have had lengthier discussions with them today, and they also need. I mean, they're working with BBMP team to seek the necessary approvals to roll out the program from Jan 3rd onwards. It will be for 15 to 17 years age group Covaxin. And for people who have completed 39 weeks, the second dose, those people typically currently the only people who would qualify right now in the January first week would be the healthcare workers. I think by end of January or beginning of February is when the booster dose would be eligible for 60 plus, because they have to complete the mandatory 39 weeks. But I think it's a very good question, JC sir and Trilok Chandra sir. Any plans for BBMP to roll it out, like other than PHCs? Any other camps are planned for this booster dose and 15 to 17 vaccination?
January 3rd, we'll be launching for 15 to 17 age group. We are already had preparatory meetings with the education department, the PU board, the Commissionerate of Public Instruction, the labor department, and also the ITIs and the other NGOs who are handling out of school kids as well. So initially there'll be two-pronged strategy. One is we are mapping all the schools to the respective zones so that our teams will go to these institutions and vaccinate there itself. That is the one category of cases. Second one is walk-ins are also allowed to any of our PHCs. People can walk in and get the vaccination done. That is the second mode. And of course, kids who are out of school or the colleges who are working in various places, they're also being covered, including the various construction sites which are there. So all the entire spectrum is being covered. And of course, you have the option of going to any private hospital, and they can also do the vaccination. So the multi-mode approach is available. So people are free to utilize any of these channels.
Yeah, sure, sir. Okay, then I think we are on top of the time, but just two more questions. I think one thing is like from my side, like because when we are discussing with the hospital, so some of the thing what they also ask is for tie-ups with schools, etc. So mainly, I think the age group for 15 to 17 means 10th, 11th, 12th standard. So is there something that BBMP is trying to do to reach out to some of the schools in this area to do some camps, because hospitals are also keen to do that. So to address that 15 to 17 age group.
Yeah, that's what I said. We are mapping all the schools which are there in the respective zones, and our teams will reach out to these schools and get the vaccination done at the school level itself.
Okay.
So that
sir,
is
good evening, sir.
Yeah,
Surendra ಮಾತಾಡ್ತಿದ್ದೀನಿ, sir.
Yes, sir. Really, Surendra.
We have mapped all the schools already, and total 423 schools and 78 pre-university colleges, and the total strength is 48,000 already. Beneficiary list we have prepared. And from Saturday onwards, the portal is opened, and anybody want to register in the portal, COVID portal, they can register, or if they want to walk in this thing, they can come to the PSC and they can have the vaccination. We are taking up schools and colleges from Monday.
Got it, sir. Great. Yeah, I'm making a note of it. Yeah. Thank you, sir. Then I think one final question from Ajit side is, are we tracking like which COVID variant has been reported more in the apartment clusters? Is it Omicron or we are not testing? Yeah, that's a question from Ajit. Yeah.
Right now, earlier we were only sequencing only the foreign returnees. From couple of days, we are sequencing all positives in Bangalore.
Omicron variant.
Surendra, you can mute. Yeah, so yes, all positives in Bangalore are being sequenced now.
Yeah.
So that is the scene right now.
Sure, sir. Thanks a lot for that. I think there are no further questions. I would like to extend my heartfelt thanks to the BBMP team, Dr. Trilok Chandra, Venkatachalpati sir, Dr. Surendra, and the whole team of BBMP Mahadevapura. They're always available for any help. If we just a phone call away, and we would also, as apartments, we would like to work with you together to prevent the COVID measures. And I wish everyone a very happy new year, and I hope BBMP teams will get some breather time in this peak times of violations or things like that. So I hope everyone gets a happy new year, and let's celebrate responsibly, and let's have, as Vikram also suggested, to have muted or minimal celebrations to ensure that we don't cause wave 3, or let's try to keep the cases at check. Thank you so much. Thanks everyone.
Thanks a lot. Thanks to everyone.
Thank you and happy new year to all of you. Thank you.
Thank you.
Thank you. Bye.
Thank you. Bye.